Today we're going to talk about depression. Depression, when sadness is no longer transient and you forget how it feels to be happy. Clinical depression is a medical condition that causes profound, long-lasting symptoms and often interferes with the daily activities that we try to complete. Many are likely to develop this disorder based on changes in the brain function, genetics, the way you cope with different things in life, and life stresses and circumstances. Depression is the most common psychiatric disorder all over the world. In the United States particularly, nearly 20% of the population experiences a bout of clinical depression at some point in their lifetime. People may be reluctant to discuss their depression symptoms for a number of reasons. Often, they're concerned about the stigma of mental illness. Sometimes they worry that a primary care provider is not the appropriate healthcare professional to ask about symptoms of depression. Some see their condition as a personal weakness rather than a quote-unquote real illness. And some are worried about the implications of having a psychiatric illness enter into their permanent record. People with untreated depression have a lower quality of life, a higher risk of suicide, and worse prognosis if they have any medical conditions alongside depression. In fact, people with depression are almost twice as likely to die as people without depression, mostly due to other medical conditions. What's more, depression affects not only the person with the disorder, but also those around them. So it is important to identify those symptoms associated with depression because they might not seem too obvious for many. Depression can take many forms and has varying levels of severity. Part of the variability in the disorder happens because it can happen at the same time with many other mental disorders, such as anxiety or substance use disorders, which shape the symptoms of depression. Someone with 5 or more of the following symptoms most of the day, nearly every day, for at least 2 consecutive weeks, might be having depression. For example, depressed mood. Some people with depression feel anxious, annoyed, frustrated, irritable, or even angry. You may be losing interest or pleasure in most of all activities that you normally do. Many may withdraw from or lose interest in friends, social activities, or hobbies. Some people even lose interest in having sex. Appetite and weight change can happen with depression symptoms. Depression often affects sleep patterns, leading people to either sleep too much or be unable to fall asleep or even stay asleep. Agitation and restlessness are common, although some may have the opposite effect and feel really slowed down. People with depression can feel inadequate, inferior, worthless, or like a failure. They often carry tremendous guilt about things that they may have done or not done in the past. Some people may have trouble thinking clearly, concentrating, or making decisions. They can also be easily distracted or complain of even memory problems. In elderly patients, it is common to see that people are concerned or relatives are concerned about potential dementia, when truly what is going on is the presence of depression. People who are depressed can experience recurrent thoughts of death or suicide and may attempt suicide. Depression is real and quite common. So stop and think if some of the symptoms you're experiencing, or if you've experienced some of the symptoms that we just discussed, might be related to this, and seek attention. Understand that you're not alone. These are the 5 things I want you to remember about depression. This is a medical condition. It's not about weakness. It's not about personal weakness. There are multiple factors involved in the development of depression. There are multiple manifestations of depression. Social stigma is often a barrier for people to seek help. And definitely, untreated depression often leads to lower quality of life and even death.